My name is Josh. I'm a physical therapy student at UCF, and I'm going to be performing some manual muscle tests, some range of motion, and an ankle girth measurement on my patient here and their foot. So first, before I begin, I want to make sure that she's comfortable and in the right position. So I'm going to ask that you lift your legs up a little bit. Let me put this bolster under your knees, so that will help put her gastroc on slack. I want her knees to be at about a 20-degree angle or more to keep that from being tight. And I'm going to begin with a muscle girth assessment. And so to do that, first I need to find the tibialis anterior tendon and the lateral malleolus. So I'm going to begin right in the middle between those two. I'm going to wrap around distal to the navicular tuberosity, under the foot, and then proximal to the tuberosity of the fifth metatarsal, then up around and distal to the medial malleolus, behind the Achilles tendon, distal to the lateral malleolus, and back to the start. And when I pull it tight here, I get about 47.5 centimeters. And to make sense of that, of course, I'd want to measure that against the other ankle and see if the girth was different, maybe if there's some swelling. Next, I'm going to measure her first MTP extension. I expect a value of about 70. So first, I'm going to put the axis here at the first MTP. I'm going to put the stationary arm parallel in line with the first metatarsal, and the movable arm will be parallel with the proximal phalanx, so the first toe. So I'm going to move this until I feel firm infield, and I'm getting a value of about almost exactly 75, maybe 76, which is a little more than 70, but within expectation for normal limits. Next, I'm going to measure her ankle inversion. So my axis is going to be between the two malleoli. The stationary arm is going to be parallel to her tibia, her distal lower leg, and then the movable arm is going to be parallel to the second metatarsal. And I'm going to see how far I can push her again expecting a firm infield and range of motion somewhere around 35 degrees. And let's see, right at about 50 is a little high, but she might have some laxity. Then next I'm going to do a manual muscle test for the tibialis posterior, which is a plantar flexor and an inverter. And because I know that it's an inverter, I want to test her against gravity. So I'm going to put her into a little bit of external rotation, and then I'm going to put her in the test position of plantar flexion and inversion. I'm going to ask if you can hold this, and I'm going to assess. So I see that she can hold this without too much difficulty, so I'd first score her as a 3 on manual muscle test, indicating that she's able to hold against gravity and maintain the test position. Then I'm going to ask that you hold this position and don't let me move you when I apply resistance. And I'm going to stabilize her ankle, and I'm going to push her into dorsiflexion and eversion. So don't let me move you. 2, 3, 4, 5. And so she has great strength for that. I would definitely score her a 5 out of 5, which indicates that she can hold against strong resistance. And finally, I'm going to test her tibialis anterior, which is a dorsiflexor and an inverter. So again, I'm going to start with a little bit of external rotation so that she'll be working against gravity. And first I'm going to see if she can hold the test position. And again, so I know I'm going to start with a minimum score of 3. Then again, don't let me move you, and I'm going to pull her into the direction of plantar flexion and eversion. Don't let me move you. 2, 3, 4, 5. And again, she's able to withstand pretty easily, so I would score her a 5 out of 5. And in general, I think she seems to be quite healthy. So thanks for your help.